Hi everybody. This week we're looking at designing systems for augmentative communication. Before we totally can choose something, we really have to know the client fairly well, and as DSWs, you know them really well. You will have some input into the design of the system. You may begin designing systems with clients from the get-go. You just want to make sure that they don't have an existing program in place. Then you're trying to reinvent the wheel. You want to use their existing skills. And, you know, we can use aided systems, unaided systems, sign language, pictures, picture exchange. We can use technology. And a total communication approach is an approach that uses a combination of speech and sign and pictures, and we look at a really thorough way of communicating. So pretty well whatever works. The first thing you want to do is to assess the individual. So you want to look at what kind of nonverbal behaviors do they have? What kind of communicative behaviors are they already exhibiting? Are they looking, pointing? Do they have eye contact? Are they pushing things or moving things away or grabbing things or reaching for things? Do they smile? Do they frown? What kind of facial expressions do they have? So if you're looking for current vocalizations, you're already assessing the individual and you know what they have to start off with and what kind of idiosyncratic or strange behaviors do they have that indicate that they're communicating. Sometimes in order to understand an individual completely, you do have to have like a complete assessment and a full holistic understanding of their vision, their hearing, their motor control, how do they sit, what are their needs to communicate, do they have any kind of a vocabulary, what are their social and emotional needs, what does the family want the child to be able to do. So we look at all of these factors when we're thinking about assessing an individual for communicative devices and AugCom devices. So you want to choose a system that will immediately reward the individual for what it is that they want. So you want to take an inventory of the wants and the needs of the individual. This little girl wants a cup, and so right away you could start thinking about how to get her to communicate the fact that she wants it, she's reaching for it, and she obviously will need some assistance, so she needs to ask you, and so in this case, you know, you want to figure out what it is that they want, and once you've figured that out, then you can start to design a system that will meet their needs and have an immediate reward. And that will allow the individual to recognize that that they have results from communicating. In this case, we could have a picture of a cup and hold it in front of her and get her to touch it. And once she points to the picture, then she gets the cup. Something as simple as that. So you want to note what it is that motivates them and try to get them to communicate about it. And sometimes you have to modify the environment in order to elicit a communicative behavior, and then the child is rewarded for that behavior. We'll talk a little bit about more about this when we talk about teaching someone how to use their device. So where to begin? You have to think about the most abstract thing versus the most concrete thing. So the most concrete thing here would be, I want to play with the dog. I point to the real dog and I'm playing with the real dog. So that's very, very tactile, very, very concrete, very, very real. Whereas if I'm describing a dog to you in language, that's extremely abstract and symbolic, and it's words and it's letters, and the word dog doesn't resemble in any way the actual object. So when we look at the things that are most concrete, most tactile, and most real, then there's a continuum along this line that gets more and more and more abstract. So you want to assess the person's ability and start at the very beginning with real things, then a representational object, so maybe a stuffed dog, then maybe a large colored picture of a dog, a smaller picture, then a black and white picture, then a small black and white picture, then maybe a hand drawing of a dog, then maybe some kind of a symbol to represent the dog, and then the word dog. So you want to start assess something that, like, don't make it too abstract that they don't understand it. So if they didn't understand a small colored picture, make the picture larger. If they didn't understand the large colored picture, then get a stuffed animal. If they don't understand that, then you have to use the real object, which is the most concrete thing of all. So that's a continuum of concrete to abstract. When you're thinking about the first symbols, think about what the person wants and needs, the environment that they're in. You want to think about teaching them the things that are the easiest things to learn, and then you can up the ante later and choose the most abstract image that's recognized by the individual, and then move your way to more abstract as the person's learning. Children usually want to talk about their environment, their friends, school, people, objects, toys. They want to talk about, they should have some way of talking about what they did yesterday, what they want to do tomorrow, social greetings, happy birthday, my name is, could you please put on my pink sweater versus my blue sweater, and that kind of thing. So the first 10 to 20 signs or symbols that you would use are the ones that are the easiest. So ones that are easy to learn, easy to demonstrate. And think about the first words that children usually speak. It's usually mummy, daddy, up, play, ball, juice. So take advantage of their existing facial expressions and sounds and gestures. And make things very specific. So chocolate milk, not drink. Later on, you can break the board into several, or whatever system you're using, you can have several different types of drinks. But if you know that it's chocolate milk that they want, you may initially just have chocolate milk and water, but not the word drink. So you want to be very specific. Because if they point to drink, then and you've got nowhere else to figure out, well, what do you want to drink? Then you're stuck. So you need to have something specific. You want to choose symbols that will be used frequently. So something to drink, wanting to go outside, wanting to play with a toy, wanting some music, whatever it is that you feel will be used over and over again. And have some opposites. So you want to have maybe happy, sad, or you want to have more and stop or finished. So have some opposites. Requesting and rejecting is super important. So this is a way to say, I want more, please. These are taught very, very early. And then rejecting, stop, finished, I want a break. Super, super important on your first system. I'm going to tell you a story about Emily. Remind me when I see you in class next. And I'm just going to end this show because I actually have the wrong slides. Bear with me. I'm just going to pick up where we left off. This is the slideshow that I wanted here. Okay. Okay, so when we're looking at using an approach towards teaching someone how to use their system, there's two main approaches. One is referred to as the developmental approach, and the other is referred to as the functional approach. A developmental approach looks at the normal sequence of language development. So we looked at developmental milestones, and you know that they are in a building block process from 0 to age 8. So this is considered the developmental approach. So they set each developmental milestone as a goal. Once the child has reached step 3, you move on to step 4. So you want to make sure that there's a building block, kind of a step ladder, systematic approach in place. So they've met a certain criteria, they're doing what they're supposed to do, and they move up the ladder to the next rung on the ladder. That's a developmental approach. It's usually used for young kids, and it goes way, way back to the very beginning of language development. Whereas the functional approach can be used with all ages. It uses what the person wants right now that's going to give them an immediate result. So it's very, very functional in nature. It uses the motivating objects or events that are around them right now in their immediate environment, and it helps you help identify what those things are, and once they learn to communicate about them, it has an immediate function. So it's relevant to here and now. It's not based on some kind of system of what they're supposed to be doing at a certain age. So let's go to the developmental approach for a moment. So we know, for example, between 2 and 3 years, all of these things on the checklist the child is supposed to be doing. So let's say they're 7 years old and they're now speaking in 2 to 3 word sentences, and they're now using questions to say things like me up or my ball or have juice, and they're using plurals, but when we move along the scale, they're not doing anything in this category. So you would say yes, 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 all the way down here. And then the developmental milestone between 3 and 4, all of these things would then become your objectives. So in the developmental approach, you would be using these next milestones to teach them how these would become your goals. So you would want them to be able to describe, for example, what they would use an object for. And once they'd achieved that, then you would move on to the next step and the next step and the next step. So it's very sequential. Whereas the functional approach is completely different. So think about the communicative functions of language, right? Social greetings, saying hello, what's your birthday, may I please have, wanting whatever it is that you want, you need, being able to say yes, being able to say no. These are very functional things. And this can be for any age group whatsoever. So the functional approach looks at immediate functions of language. The developmental approach is for young children. It's used when their speech is delayed. So we know that they have some speech and that it's just, we're wanting to move it along the milestones, achieving one step at a time. And it's, so you move on to the next milestone, and it follows the normal way that language would be acquired. So the developmental approach is best for children. The functional approach is often used when speech isn't possible. So you might use it with an adult, let's say, who is in a social setting and wants to be able to say happy birthday to a friend who's coming into the classroom. So you would set something up where maybe a Big Mac that they would touch and it would say happy birthday to the person walking in the door. It stresses everyday language in a natural setting, and it meets an immediate need. So saying happy birthday to somebody who walks in the door might be more important than use of pronouns or plurals. So it's an immediate need. This is pretty well what I found in a textbook about a teacher's assistant who was working in a school-based program with multiple and severely disabled individuals. And the curriculum focused on functional and community-based activities. So it's not about expanding sentence structure or a repertoire of phonemes or increasing the vocabulary. It's functional tasks. Ordering something in a restaurant, requesting change, understanding instructions in a janitorial job. So those are all functional augmentative communication strategies. And it's really fun because you really get to help the person express what it is they want to express. You're not as concerned about language acquisition and the development of language in a mastery milestone kind of a way. So often use the functional approach for adolescents and adults. If somebody's learning a new job and they need to be able to talk about their new position or have certain words that they need to use on the job, it's perfect for vocational candidates. People who just have inadequate basic communication skills. And it's different from the developmental approach because the content is not arranged in any kind of a sequence, and the worker bases their choices of what is to be taught to the individual based on the high priority needs of that individual. So it has nothing to do with their chronological age, and it doesn't work in a sequential fashion at all. And the rationale is that, you can't go all the way back to goo goo and gaga and ball and one-word sentences if you're working with a 40-year-old. There may be some very pressing needs to communicate and some demanding things that they need to be able to say today. So we don't go back and teach all the basics. It's the real world, real objects, and the here and now. So it can be used at a young age. If the child makes the sign for grapes and gets a grape, that's an immediate reward for a functional request. You can see that he's signing the word grapes and he gets a grape and he's a happy camper. It's a very functional request. So if you were looking at these examples, so this is Bridget. She just got a new position returning carts at Loblaws, and her developmental service worker is coaching her. So she has no speech. She needs to communicate to the customers and ask them if they're done with their carts. And she would be saying, "May I take your cart?" So in order to get marks for this lecture, I want you to think about this, and I would like you to respond in discussion board. How would Bridget go about returning the carts? She has no speech. She needs to communicate. I'd like you to put a little post in discussion board about Bridget, and then I'll know that you've gone through this lecture. Included in your post will be a posting about Carlton. He is a Walmart greeter. What does he need to say? He's only able to use gestures. Which approach would you be using? The functional approach or the developmental approach? And what do you think you could teach him to do? This is Valerie. She's functioning at about 12 months old. She uses one-word sentences, and she has an expressive language of about 400 words. Her biological age is 26 months. So now we're working on building two-word sentences. Please answer the question, what approach are we using with Valerie? This is Rodwell. He's able to memorize small phrases. He was just asked to be a lunchtime assistant for a preschool class. What approach would you use and what phrases would you teach? At the end of this lecture, there will be a little discussion board where you can put some of your creative ideas, and that's the way that you'll get 2.5 marks for this particular week, as well as the 2.5 marks for attending the lab. That's it for this week. Bye for now.